Welcome to Sri Ram Medical College. Today we will explore radiology and women's health, understanding the role of imaging tests in obstetrics and gynecology. Acute and chronic conditions may be diagnostically evaluated with the aid of imaging studies. A woman will always be evaluated using X-rays, ultrasonography, CT scans, nuclear medicine, and MRIs, regardless of whether she is recognized or unrecognized as pregnant. Confusion over the safety of these modalities has led pregnant and lactating women and their infants to avoid useful diagnostic tests or interrupt breastfeeding. Obstetricians and gynecologists must weigh the risks of radiation exposure and contrast agents against the risks of non-diagnosis and worsening of illness when caring for pregnant and breastfeeding women. For pelvic imaging to be appropriately interpreted, it is necessary to have an accurate orientation. As much imaging is performed using organ-specific planes, the practitioner must be aware of the scanning orientation in order to accurately interpret the findings noted on the image. Gynecologic ultrasound imaging can be performed in two basic ways, transabdominal and transvaginal. Transabdominal insemination is performed by inseminating the pelvis through a partially distended urinary bladder to minimize acoustic impedance caused by bowel gas interposed. You can evaluate pelvic anatomy using either static scanning equipment or real-time equipment offering sagittal, axial, and oblique planes. Timing of the examination depends on the clinical circumstances. MRI before 18 weeks provides limited diagnostic information and is not recommended. From 18 to 24 weeks gestation, MRI can provide additional details regarding the severity of a malformation if the patient is considering termination. If termination is not an option, scanning in the third trimester when organ development is more mature provides maximum information. This is particularly true for the brain. The ALARA principle, keeping acoustic output levels as low as reasonable achievable, should be used whenever ultrasound imaging is clinically indicated to minimize fetal exposure risk. An ultrasound machine for obstetrics is configured differently than one intended for a non-obstetric application. The machines with non-obstetric transducers and settings deliver higher temperatures. In addition, even though color Doppler has the highest potential to raise tissue temperature, it is not associated with any health risks in pregnancy when used appropriately for obstetric purposes. Because ultrasonography can pose a number of risks, it should only be used when it is expected to answer a relevant clinical question or otherwise provide medical benefits to the patient. The main advantage of MRI over ultrasonography and computed tomography is the ability to image deep soft tissue structures without operator dependence. Pregnant women do not require any precautions or contraindications. While magnetic resonance imaging is similar to ultrasonography in diagnosing appendicitis, it is preferred since it has lower non-visualization rates than ultrasonography when it is readily available. The majority of soft tissue structures are adequately imaged by MRI without the use of contrast, as opposed to CT scans. Contrast enhancement can be beneficial in certain diagnostic situations. A variety of contrast agents can be used for MRI, gadolinium-based agents and superparamagnetic iron oxide particles. When the blood-brain barrier is disrupted by tumors, abscesses, or demyelination, gadolinium-based agents can cross it and provide useful imaging of the nervous system. Non-contrast MRI is still useful when it comes to diagnostic information and in most cases is adequate when detecting placental implantation abnormalities using gadolinium-based contrast. Using ultrasound imaging, a fetus can be viewed within the uterine environment, revolutionizing obstetric care and enabling direct fetal treatment and antenatal fetal diagnosis. Among developed countries, sonographic anatomical surveys of the fetal structure are part of routine antenatal care. The use of ionizing radiation, including X-rays, is often for the evaluation of significant medical conditions or trauma. X-ray procedures can occur inadvertently prior to pregnancy diagnosis or during pregnancy. The risks associated with fetal exposure to ionizing radiation have raised concerns about the use of X-ray procedures during pregnancy. It is dependent upon the gestational age and the dose of radiation at the time of exposure that determines the risk to a fetus from ionizing radiation. In utero, exposure to ionizing radiation does not appear to pose a substantial risk of carcinogenesis. A short-wavelength electromagnetic wave known as an X-ray or a gamma ray can ionize tissues and modify normal cellular structure through both stochastic and deterministic means. According to the theory, stochastic effects, such as the development of carcinogenesis, can result from cellular damage resulting from germline mutation at any radiation dose. It is unknown what threshold value will prevent these effects from occurring. In pregnancy, computer tomography serves as an important diagnostic tool that uses specific forms of ionizing radiation, and its use has increased by 39% per year in recent years. The use of MRI during pregnancy should be considered when CT scan imaging is equivalent and available in a timely manner. CT scan procedures have varying levels of radiation exposure based on the number and spacing of adjacent image sections. In contrast to oral contrast agents, intravenous contrast media enhances soft tissues and vascular structures during CT scans, without causing real or theoretical harm to the patient. Intravenous contrast media facilitates CT scan diagnosis by providing enhancement of soft tissues and vascular structures. Most commonly, CT scan contrast is iodinated media, which is associated with low adverse effects and anaphylactoid reactions, example, nausea, vomiting, flushing, pain at injection site. In nuclear studies, chemical agents are tagged with radioisotopes in order to achieve pulmonary ventilation perfusion imaging, thyroid imaging, bone imaging, and renal imaging. In contrast to delineating anatomy, this type of imaging is utilized to determine physiologic organ function or dysfunction. Hybrid systems combine nuclear medicine imaging and computed tomography to improve the quality of information acquired and to reduce artifacts that can occur from nuclear medicine imaging alone. Breast milk contains radioactive compounds at varying concentrations and for varying periods of time, and rates of excretion of the same compound can differ from patient to patient. Breastfeeding and nuclear medicine experts should be consulted when using nuclear materials in lactating women to minimize their potential deleterious effects. For the prevention of maternal morbidity and mortality, it is necessary to investigate and manage complex medical symptoms during pregnancy. In light of the available literature, it seems likely that diagnostic imaging studies involving radiation of 50 mg at any gestation do not have any significant effects on the fetus. The use of MRI remains preferred to studies involving ionizing radiation, and gadolinium can be used for contrast-based MRIs if the maternal benefits outweigh the fetal risks. Pregnant women should receive guidance from radiology professionals regarding the best imaging method. Radiology professionals should counsel pregnant women on the best imaging method and give them a timeline for investigating the clinical question. B.VoC and meet eligibility criteria. 12th class from any recognized board. Students, arts, commerce, science, of any age can apply. A minimum score of 50% in the 12th class. Join Shri Ram Medical College's Bachelor of Vocation in Radiology and Medical Imaging Technology and take the first step toward a successful career in radiology technologist. We are here to assist you in launching your career as a radiology technologist. Call us at 9968193009 for more information about our program or to submit an application right away. Shri Ram Medical College, nurturing next generation of healthcare leaders, and offers all paramedical courses at competitive fee and helps in 100% placement assistance. Admission open. For more information, please visit our website shriramcollege.com and like, share, subscribe our YouTube channel Shri Ram Medical College. Good luck, goodbye.